Helena, you were the president of CVS Pharmacy. You headed up CVS. Now, during obviously the opioid crisis, I just want to read a couple statistics. The Kentucky AG said that in Perry County, 6.8 million units of oxycodone and hydrocodone were flooding the area between 2006 and 14, enough for 26 pills per man, woman, and child in that area. Now the New Hampshire suit says that CVS brought in 2 billion units of opioids. Now, you're a data person. Did you see these trends, and did you see the profits from them?
Right. Well, I want to start by saying behind all this data are people, families that have been suffering and struggling, and these are the people my heart goes out to. But I can tell you that as soon as we saw what was going on, we took action, I took action. I'm particularly proud of the work that I led, actually pulling together leaders from every drugstore across the country to make sure we worked on legislation to reduce the number of pills as soon as we saw this. And in fact, in Rhode Island, it passed in 2016. And so that, I think, is something, look, do I wish we'd all found it sooner? Absolutely. But when we did, I feel very confident that we took
So you're saying
action.
You did not see that increase in opioids in those timeframes that are named in these lawsuits?
I can't speak to the lawsuits. I don't work at CVS right now, and I don't want to be their spokesperson, but I can tell you as soon as we saw the data, we took action.
Do you think that you and CVS execs have a moral responsibility in this opioid crisis?
I think that we all feel a deep sense of responsibility. Every person in leadership, whether it's at companies or in the government, a lot of people miss this, and I do wish we'd all found it sooner. But that being said, I'm also a better leader for it, and I know what we can do to pull people together and really ultimately make sure that all the dollars the state of Rhode Island is receiving right now goes to serving the people who are struggling.
And again, you said you didn't see those numbers, again, the rapid increase. What would you say to folks if heading up DCYF, the deaths of children went from 2 to 40, and you said you just didn't see those numbers?
I'm quite confident that there's not a great analogy here, that we have a lot of work we can do for our children in this state. I hear from leaders all across the state who are struggling to serve the needs of kids, and I would be very honored to be able to be the leader who can help the children of Rhode Island.
Okay, Helena, thanks for your time.
Thank you.